To be able to have a patient whose face has been mangled beyond recognition, and then to give them a face that they can go out into the community and not have people stare at them, is, to me, one of the greatest gifts that we can give a patient. The face truly is the pathway to the soul. I am happiest when I'm in the operating room. I don't have a computer in front of me. I don't have my phone in front of me. I don't have my pager going off. It's kind of like I'm in heaven, and I can stay in heaven as long as that patient is there, and I can do what God has given me, my God-given talents, to put this face back together and make it look good, and hopefully, and make it look functional. So maxillofacial surgery is a specialty of dentistry. It is very closely aligned between dentistry and surgery. And our training encompasses that. And so maxillofacial surgeons will spend between 4 and 6 years of added training that will lead to board certification. My specialty deals with the defects of the face and neck, whether it's congenital, i.e. cleft lip, cleft palate, whether it's head and neck cancer, whether it is gunshot wounds, dog bites, and facial fractures. We also deal with all of the head and neck infections at Truman Medical Center and across the country. I remember going to Children's Mercy Hospital, and I saw a young girl. She was 4 years old. She was sitting in her grandmother's living room watching TV when a drive-by shooting occurred. This young lady had her whole lower face traumatized. And I took this young lady from inability to speak and inability to eat, and we were able to ultimately reconstruct her face, and now she is a mother in the Kansas City community. Well, I'll never forget a young kid came in to see me who had facial tumors. We were going to have to go in and find out what was going on with his jaws. Well, we got the tumors to regress, but as he got into some hormonal influence, as he started to get older, my tumor started to come back. And all of a sudden, he came to me and he said, "Dr. Fergie, what can you do? I want to be normal like the rest of the kids." We sent him back to have some more genetic testing, and we found a clue to his tumors. And so we went with the medical oncologist at Children's Mercy Hospital, and then we called Mayo up. And we found a possible pharmaceutical process that may allow this child to have his tumors undergo resorption. Here we are, 6 years later from when we started, and this little fella now has stopped his growth hormone. He has now got height of about 5'3". He's got a voice that's just slowly changing, and he's got a face that a girl told him, "You know something? You're cute, I like you." Well, Connor, we wanted to kind of visit with you today because I got some pretty good news for you. We want to see? All right, why don't we step up the hallway so we can kind of see? Look at the cysts. Look how big they are. Look over here. So it took up your whole jaw.
Oh, that's a shot.
Yeah, that whole thing. Now look at him. This one is gone. Can you see that? And how long we been dealing with this one?
4 years.
How long? And look at this one. Regressing, and the teeth are even coming in. When you look at Truman and you say safety net hospital, does that mean you get inferior care? Does that mean that you've got an institution that does not rise to the level of the other institutions in your community? I say no. And the reason I say no is, do you know I get referrals from the whole metropolitan area? We got 2 million people in this area, but we don't have very many oral and maxillofacial surgery residencies. In fact, there are none in Kansas, there's none in Arkansas, we are the only one in Missouri. And so we see over 10,000 patients a year. We perform over 700 operating room cases a year. And that's because our expertise is not throughout the community. And so we get referrals from Kansas, Arkansas, and Missouri. Born in the projects, didn't know what that meant at the time. Had a special needs brother who was able to obviously access the medical care system because he had 10 operations before I was 6. I came from a broken home, and it was my grandmother who raised me. And I don't know about you, grandmas don't do well with bad kids. My dad then came back on the scene and then raised me from 6th grade until I went to college. And my dad was a man who didn't show a lot of love. I knew my dad loved me, but I knew I couldn't disappoint him. He had a very high standard for me. I went to Lane College in Jackson, Tennessee, and it was at Lane College that I understood what it was like to be academically talented, and I learned how to compete because Little Lane College sent me to Harvard Medical, and I got to go there doing one summer, and I'll never forget it. It was a nationally competitive program, and they had 100 African-American students in this program, and I have heard that over 90 of us have gone on to achieve academic superiority and went on to become leaders in their field. So that program showed me how to compete. I remember when I was in and fully boarded as a maxillofacial surgeon, and my national organization said, we need somebody to run education and training for the United States. I was looking at the ceiling, hoping that my name wasn't going to be called. My name was called, and I had to rewrite all the standards for residency, education, and training for the country. Well, that job was very close to when I became president of the medical staff at Truman. Then I became president of the foundation at the university. And then going on the political end and rising to the level of president of the American Association of Oral Maxillofacial Surgery. I was the 100th president and the first African-American officer. And you know why? It's not because I'm special, but it's because God gave me the opportunity to provide this opportunity to let somebody else look at me and say, if Fergie can do it, I can do it too. And that's what I tell my trainees. There's nothing special about me. Put your nose down, put your head down, try to be the best person you can be ethical, but be the best surgeon you can be. Be available, be affable, and your talents then should lend themselves to your community. Dad, look at that.
Yeah, that's nice.
Look at that.
It's big improvement.
That's huge. The upper jaw is looking very good, and now we're trying to get some matching from the lower. I am Truman, and Truman is me. The community is Truman, and Truman is part of the community. What we need to do is establish a bond that will be ever, ever stronger going forward, that the only way that Truman can be successful is by having a successful community that's healthy. And if we partner together, nothing can stop us from having the best community we can have and the healthiest community we can have. And with the individuals in this room who can participate in the financial support, we will have an institution going forward that all of us will ultimately be so proud.